We're pleased to welcome our friend Bob Marino, Chairman and Chief Executive Officer, Horizon Blue Cross Blue Shield, New Jersey. Bob, good to see you.
Good to see you, Steve. Good to be here.
We fully disclose, and we want to fully disclose that you are a member of the board of public television in the state of New Jersey. But we're not here to talk public television. We're here to talk about the changing landscape of healthcare. But we often talk about we're moving from what was called fee-for-service to a more, quote, patient-centered care model. And I'm asking myself, haven't we always done that? Or what's different? Talk to us.
Sure. Well, you're right, Steve. What we're doing and what Horizon's committed to doing is really changing the way healthcare is delivered and paid for in the state of New Jersey. Today, healthcare is delivered and paid for in New Jersey, as it is throughout the country, on something called a fee-for-service system. And as the name suggests, the way the reimbursement works, the services or more services you do, the more reimbursement you collect. Fundamentally, it's not a sustainable economic system. So we need to move to something that creates more value for the healthcare dollar. So Horizon is very committed to transforming how we pay for and deliver care from fee-for-service to what we call fee-for-value. So people will always ask me, well, can you define value? What does that mean? So we define value three ways. The first way we define it is that we have better outcomes and improved care. The second thing is we have more patient involvement, better patient experience with the delivery of care. And third and importantly, we're able to lower the total cost of care. So when we talk about transformation, we want to move from this unsustainable fee-for-service system, which basically does not provide coordinated care. Essentially, it's an inflationary kind of system, to a system that rewards value. And again, value being defined as better quality, better outcomes, better patient experience, and lastly, lower total cost of care.
Bob, it makes sense, logical, but I'm asking myself, what does it mean, what could it mean for patients on the other end of this?
It's a fair question, and here's what it means from our perspective. Number one, patients will receive better care, more coordinated care.
What does that mean, more coordinated?
More coordinated care. Today in our fee-for-service system, care is delivered on a very fragmented basis. I'm certain you know of stories of folks who see one physician orders a series of tests, see another physician, and another series of tests are ordered. Uncoordinated, fragmented care. So when we talk about patient-centered care, we're really talking about a primary care physician, a family care physician, coordinating all of the needed care for that patient, ensuring that the patient's getting the care in the right setting, at the right cost, at the appropriate time. Importantly, when a physician practices what we call patient-centered care, they act as sort of like the coordinator of the overall health care for all of the patients in their panel, if you will. And instead of just going in to see the doc because you've got, an acute bronchitis, your doctor, when he or she is practicing patient-centered mental care, is really looking out for your total well-being, making certain that you're getting the right preventative care at the right time, et cetera. And as we're able to transform the delivery system to do that, patients will see improved care, more involvement with their care, appropriate care at the right time, at the right place, and importantly, lower total cost of care because services are being better coordinated.
The other thing is I've done a lot of leadership development, coaching at Horizon, yes. So I've gotten to know your people a lot. And one of the things that your people tell me is that one of the challenges they face is communicating a lot of what goes on in health care and health insurance
Absolutely.
To the average consumer. How much of this, frankly, is a product of communication and breaking things down so the, quote, average consumer can get it?
Steve, you're right on point. I think one of the biggest challenges that we have in healthcare, it's a very complicated, complex business.
By design?
Well, healthcare is a lot different than, if you will, manufacturing number 2 pencils. It's a lot more complicated, if you will. And I think one of the challenges we have is that we speak a totally different language than the average consumer. And I think the challenge for us and other organizations in our business is we need to speak a different language, need to make it simpler, less complex for members and consumers to understand. When you talk about concepts like patient-centered care, folks say to me, are you talking about nursing homes? No, we're really not talking about nursing homes. So there's a lot more work we need to do to really communicate the message, simplify the message, and make the end consumer, the user of healthcare, really understand what we're talking about when we talk about transformation of healthcare.
I'll tell you what, go back to how you started this conversation, the economics. One thing everyone understands is when you can't pay for things. You said the system, fee for service, is not economically sustainable. Please help us understand that again. Why is it not sustainable? Why can't we just keep doing what we're doing?
Well, because to be honest with you, when I talk to employers, I talk to small business people, I talk to individual families and consumers, and they find out what I do for a living, the first thing they will tell me is, we just can't afford this. It's too expensive. What are we doing about controlling the cost of care? And fundamentally, we need to change the system. The system of fee-for-service is a system that grew out of perhaps World War II, when employers first started offering health insurance coverage. And by design, if you listen to the words fee-for-service, it means the more services I do, the more fees I collect. It's not producing the value that we need in healthcare.
Excuse me for interrupting. The more tests ordered, the more I get paid. Doesn't work.
Doesn't work. It's not sustainable. You know, New Jersey, unfortunately, is probably one of the states with the highest cost of health insurance, and certainly one of the highest cost of health insurance premiums. Some of this is driven by the fact that the current system of fragmented delivery of care, which we have through the fee-for-service system, simply isn't sustainable. When we look at medical inflation, here in New Jersey, medical inflation probably runs somewhere between 5 to 6% a year. Compare that to general inflation that runs a little over 1%. So even though people talk about, well, the rate of inflation in healthcare is coming down, it's still a big number when you compare it to the overall consumer inflation. So we need to fundamentally change the economics in healthcare. We need to move healthcare more towards a value-based system where reimbursement is based on the quality of care, the outcomes that are produced, the patient involvement, and then lastly, lowering the total cost of care.
The reaction you've gotten, you were talking to our news anchor, Mary Alice Williams, about some of these issues, and one of the areas that you started to get into, I want to follow up on, is the reaction you've gotten from the others in the healthcare community, more specifically, not just the physicians, but the hospitals. On board?
Clearly they are. You know, we're really excited about the work we're doing. For the last 3 or 4 years, we've been collaborating with key physicians and hospital organizations. We now in New Jersey have the largest network of patient-centered medical home physicians. We have over 6,000 physicians that are involved in patient-centered medical care delivery. We also have a series of what's called accountable care organizations and episode of care. These are very new, innovative payment models of how we pay physicians in hospitals that really puts the focus on the quality as opposed to the volume. Results, we're very encouraged by what we're seeing. For example, we did a study in 2014 based on 2013 data. We took 200,000 of our customers that are getting care through patient-centered medical homes, and we compared them to 200,000 comparable patients who are not getting care through patient-centered medical home. And the initial results are encouraging. For example, we saw for the 200,000 people that were getting care through patient-centered medical home, 14% improved rate of diabetes management, 12% improved rate of cholesterol management, 8% higher breast screenings, 4% higher screenings for colorectal cancer. So the indications are positive. When you look at some of the cost metrics associated with this, we found that those 200,000 members in patient-centered medical homes, 4% less visits to the emergency room, 2% less admissions into hospitals, 4% overall lower total cost of health care for these 200,000 members compared to 200,000 that are not in patient-centered.
That's optimistic.
Very optimistic. We're encouraged. We're encouraged. We're committed to this. It clearly is the strategy of our company to lead the transformation of healthcare from fee-for-service to fee-for-value over the next 3 to 5 years.
Bob Marino is the Chairman and Chief Executive Officer of Horizon Blue Cross and Blue Shield of New Jersey. We'll continue this conversation as this transformation in the healthcare world continues. Thank you, Bob, for joining us. We appreciate it.
Thank you. Thanks for having me.
Stay with us. We'll be right back right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. This special edition of One-on-One with Steve Adubato is brought to you from the Tisch WNET studios at Lincoln Center. Funding has been provided by Wells Fargo, the New Jersey Education Association, United Water, Robert Wood Johnson University Hospital, the Robert Wood Johnson Foundation, New Jersey Sharing Network, and by Choose New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.